Hello everybody, I am Dr. Saujatya Chakroborty and today I would like to talk to you a little about heart failure. What exactly does heart failure mean? When we say heart failure, it encompasses actually a lot of conditions which have in commonality that the heart function is impaired, which might be an impairment of the contractile function of the heart or the relaxation function of the heart. What we as cardiologists are seeing over the years is that the incidence of heart failure is increasing in our society. This may be because of the increasing age of the population, so people are surviving till longer ages now. Also, it is also because of the increasing incidence of many risk factors which predispose to heart disease, like coronary artery disease, factors like hypertension, diabetes, kidney disease and so on. In spite of the increasing incidence of heart failure that we are seeing, awareness for this condition is still not very optimal in the general population. This is because of multiple factors. Actually, many of these patients are, especially the age group of heart failure patients, is such that many of them have other comorbidities, which means that they have other conditions like, say, lung problems, anemia, limited mobility, or other conditions which might also be contributing to symptoms such as shortness of breath, because of which the diagnosis of heart failure takes time to occur. This is something which is avoidable and which is not advisable, because the earlier we diagnose heart failure, the better it is for the overall prognosis of the patient, because the earlier we start the goal directed treatment for these patients, the better is survival for such patients. So any person who has the telltale signs of heart failure like shortness of breath, swelling of feet, chest discomfort, or any sort of uneasiness which was not there in the past, and if that person has risk factors like high blood pressure or sugar or some pre-existing heart disease, they should always make it a point to go to the cardiologist and get simple blood tests done, which include blood tests and also basic tests like ECG and echocardiography, which go a long way towards the diagnosis of heart failure. As part of heart failure awareness, it is essential to know that this condition can be diagnosed very simply by very simple tests, and if detected early on in this course, the treatment options that we have now portend a very good survival as well as quality of life for such patients of heart failure.